In recent years, interest in male sexual health has increased significantly, especially around topics such as penile size, performance, and confidence. As a urologist, it is important to begin this discussion with science, not myths. Many men are exposed to exaggerated claims online, leading to confusion, anxiety, and unrealistic expectations. This chapter focuses on what medical science actually says about penile length and what can and cannot be influenced safely. First, it is essential to understand normal penile size. Large-scale medical studies have shown that the average erect penile length typically falls within a relatively narrow range. Most men who believe they are below average are, in fact, well within the normal spectrum. Much of the dissatisfaction comes from psychological factors, comparison with unrealistic media portrayals, or misinformation spread by unverified sources. From a medical standpoint, function and health are far more important than size. From a biological perspective, penile length is primarily determined by genetics and hormonal exposure during puberty. Once adulthood is reached, natural growth largely stops. This means there are no pills, oils, or supplements that can magically increase penile length permanently. Any product claiming rapid or dramatic enlargement without medical backing should be approached with extreme caution. However, science does recognize that certain medical and physical factors can influence apparent or functional length. One such factor is body fat distribution. Excess fat in the lower abdominal and pubic area can partially cover the base of the penis, making it appear shorter. Clinical observations show that weight loss in overweight individuals can lead to a noticeable increase in visible penile length, even though the actual anatomical size remains unchanged. This is one of the safest and most reliable ways to improve appearance. Another key factor is blood flow and vascular health. Erections depend on healthy blood circulation. Conditions such as smoking, diabetes, high blood pressure, and sedentary lifestyles can impair erectile quality, making the penis appear smaller or less firm. Improving cardiovascular health through regular exercise, a balanced diet, and adequate sleep can significantly improve erection quality, which many men interpret as an increase in size. Medical literature also discusses penile traction therapy, a method used under professional guidance. This technique involves applying controlled, consistent stretching force over extended periods. In clinical settings, traction devices have been used for specific conditions, such as penile curvature, and have shown modest length improvements in some patients. Importantly, results are gradual, limited, and highly dependent on correct usage and medical supervision. Improper use can cause injury. At this stage, it is crucial to separate evidence-based approaches from myths. Exercises promoted online without scientific validation, extreme stretching methods, or unregulated devices often pose more risk than benefit. As a urologist, patient safety is always the priority. In the next part of this chapter, we will discuss clinically studied methods, including medical procedures, their risks, realistic outcomes, and who may actually be a candidate for them. Understanding both the benefits and limitations is essential before considering any intervention. In this second part of Chapter 1, we will focus on medical and clinically studied interventions, while clearly explaining their limitations, risks, and realistic expectations. This is a critical discussion because many men consider invasive or semi-medical options without fully understanding the science behind them. One medically recognized option is penile traction therapy, which we briefly introduced earlier. Clinical studies published in reputable urology journals suggest that when traction devices are used correctly, typically for several hours a day over many months, they may result in modest increases in flaccid and erect length, often in the range of 1 to 2 centimeters. However, these outcomes are not guaranteed. Success depends heavily on consistency, correct technique, and patient selection. Importantly, traction therapy should ideally be initiated under medical guidance to avoid complications such as nerve irritation, pain, or tissue damage. Another approach that is frequently discussed is penile injection therapies or fillers. From a urological perspective, most injectable procedures are designed to increase girth rather than length. While some clinics market these injections aggressively, scientific evidence supporting long-term safety and effectiveness is limited. Risks may include uneven appearance, inflammation, infection, and scarring. Patients should be extremely cautious and ensure any provider is properly trained and licensed. Surgical options also exist, but they are often misunderstood. One common procedure involves cutting the suspensory ligament that anchors the penis to the pubic bone. This surgery can increase flaccid visible length, but usually does not significantly increase erect length. In some cases, it may even reduce erection stability. Surgery also carries risks such as scarring, altered sensation, dissatisfaction with cosmetic results, and psychological distress if expectations are unrealistic. For these reasons, surgery is generally reserved for specific medical indications, not cosmetic enhancement alone. It is also important to address penile lengthening pills, herbal products, and topical creams. From a scientific and medical standpoint, there is no credible evidence that these products can permanently increase penile length. Many rely on temporary swelling effects, placebo responses, or false marketing claims. Some may even contain undisclosed pharmaceutical substances that pose health risks. As a urologist, I strongly advise against relying on such products. Beyond physical interventions, mental and sexual health plays a powerful role in perceived size and satisfaction. Anxiety, stress, depression, and performance pressure can all negatively affect erection quality. Studies show that men who improve mental well-being often experience stronger erections, improved confidence, and greater sexual satisfaction, sometimes more impactful than any physical intervention. Education is also crucial. Men who understand normal anatomical variation are far less likely to pursue unnecessary or harmful treatments. The penis, like any body part, varies naturally among individuals. Sexual satisfaction depends on communication, intimacy, and overall health, not measurements alone. To summarize Chapter 1, science does not support dramatic or instant penile length increases. However, evidence-based approaches such as improving overall health, addressing vascular issues, managing weight, and considering medically supervised therapies may offer modest, realistic improvements. The key is informed decision-making, patience, and prioritizing safety over exaggerated promises. In the next chapter, we will shift focus toward lifestyle strategies, prevention of size loss with age, and maintaining optimal male sexual health over time, all backed by medical science. As men age, concerns about penile size often shift from growth to maintenance. From a urological perspective, many men do not actually lose penile tissue, but they may experience changes that affect length, firmness, and overall sexual performance. Understanding these changes and how to prevent them is essential for long-term men's health. One of the most important factors influencing penile length over time is vascular health. The penis relies heavily on healthy blood vessels to achieve and maintain erections. Conditions such as atherosclerosis, high cholesterol, hypertension, and diabetes can gradually reduce blood flow. When erections become less firm or less frequent, men may perceive a decrease in size. Medical research consistently shows that men who protect their cardiovascular system also protect their sexual function. Regular physical activity plays a critical role here. Aerobic exercises such as walking, jogging, swimming, or cycling improve circulation and endothelial function, which directly supports erectile quality. Strength training also contributes by improving testosterone regulation and metabolic health. Even moderate, consistent exercise has been shown to reduce erectile dysfunction risk and preserve penile function with age. Another major factor is hormonal balance, particularly testosterone. Testosterone does not directly increase penile length in adulthood, but it is essential for libido, erection quality, and tissue health. Low testosterone levels may contribute to weaker erections, fatigue, reduced muscle mass, and decreased sexual confidence. If symptoms of hormonal imbalance are present, a medical evaluation is recommended rather than self-medication with unregulated supplements. Smoking and alcohol consumption deserve special attention. Smoking damages blood vessels and reduces nitric oxide availability, a molecule essential for erections. Long-term smokers have a significantly higher risk of erectile dysfunction and reduced penile rigidity. Excessive alcohol intake can also impair nerve function and hormonal balance. Reducing or eliminating these habits often leads to noticeable improvements in sexual performance over time. Another often overlooked factor is penile tissue oxygenation. Regular, healthy erections, whether spontaneous or during sexual activity, help maintain tissue elasticity and oxygen supply. Chronic erectile dysfunction can lead to tissue changes that slightly reduce length and flexibility. Early treatment of erectile issues can therefore help preserve size and function. Posture and pelvic health also influence sexual performance. Weak pelvic floor muscles may reduce erection firmness and ejaculatory control. Clinically recommended pelvic floor exercises, when performed correctly, have been shown to improve erection strength and overall sexual satisfaction. These exercises do not increase length directly, but enhance functional performance, which many men perceive as improvement. Equally important is mental health. Chronic stress, anxiety, and poor sleep elevate cortisol levels, which negatively affect testosterone and blood flow. Men who manage stress effectively often report better erections and improved confidence. Quality sleep supports hormone regulation and tissue repair, making it a foundational aspect of sexual health. In this part of Chapter 2, the focus is clear. While dramatic length increases are not supported by science, protecting what you have is absolutely achievable. Lifestyle choices made daily play a powerful role in maintaining penile health, function, and confidence throughout life. In the final part, we will discuss realistic expectations, long-term strategies, and when to seek professional help, ensuring a balanced and medically responsible conclusion. In this final part, it is essential to bring the discussion back to realistic expectations and responsible decision-making. One of the most common mistakes men make is chasing numerical measurements rather than focusing on overall sexual health and satisfaction. From a medical standpoint, a healthy, functional penis with strong erections and good sensation is far more important than marginal changes in length. A key concept supported by urology and sexual medicine is expectation management. Many men overestimate what medical or non-medical interventions can achieve. Even in clinical settings, permanent increases in penile length are usually modest. When expectations are unrealistic, even technically successful procedures can lead to disappointment, anxiety, or regret. Education and honest counseling are therefore a critical part of men's health care. Another important aspect is knowing when to seek professional help. If a man experiences a noticeable and sudden reduction in penile size, curvature, pain, or erectile quality, this may indicate an underlying medical condition, such as Peyronie's disease, vascular disease, or hormonal imbalance. Early evaluation by a qualified urologist can prevent progression and improve outcomes. Self-treatment or delaying medical advice often worsens the problem. Long-term sexual health also depends on relationship and communication factors. Research consistently shows that partner satisfaction is influenced more by emotional connection, communication, confidence, and technique than by penile size alone. Men who feel secure and informed about their bodies often perform better sexually, regardless of measurements. This psychological component should never be underestimated. It is also worth emphasizing the importance of avoiding online misinformation. Social media platforms and unverified websites frequently promote extreme claims, secret techniques, or miracle devices. These claims are rarely supported by peer-reviewed research and often exploit insecurity for financial gain. A good rule of thumb is simple. If a method promises rapid, dramatic, and effortless results, it is almost certainly not supported by science. From a preventative perspective, maintaining penile health should be viewed as part of overall men's wellness. Balanced nutrition, regular physical activity, stress management, adequate sleep, and routine medical checkups all contribute to preserving sexual function over time. These habits not only support erectile health, but also reduce the risk of chronic diseases that can negatively impact sexual performance. For men who remain distressed about penile size, despite normal measurements and good function, psychological support or counseling may be beneficial. Body image concerns are real and valid, and addressing them professionally can significantly improve quality of life. In many cases, reassurance and education lead to greater satisfaction than any physical intervention. To conclude, science does not support extreme or instant penile length enhancement. However, it strongly supports informed choices, healthy lifestyles, early medical evaluation, and realistic expectations. When men focus on evidence-based strategies and overall health, they often achieve better sexual confidence and satisfaction than they ever expected. This balanced, scientific approach is the foundation of responsible men's health care, and the message every man deserves to hear.